France makes condoms free for 18 to 25-year-olds.
Revolutionary therapy clears girls' incurable cancer.
Man who has just turned 100 refuses to give up his daily 3-hour gym sessions.
Ketamine for alcoholics trial goes to next stage.
New Zealanders born after 2009 banned from ever smoking in bid for cigarette-free future.
Man dies after being bitten by cat as flesh-eating bacteria takes over his blood.
Tube riddled with toxic air particles linked to cancer that could endanger passengers. France makes condoms free for 18 to 25-year-olds. Beginning in January, young people in France will have free access to condoms in an effort to stop the spread of STDs, STIs. At a Thursday event for young people's health, the French president made the new health initiative official. Young people would be able to pick them up from pharmacies, according to Emmanuel Macron, who called the initiative a small revolution in prevention. The national STI rate in France increased by 30% in 2020 and 2021. According to Mr. Macron, France faces difficulties in its sexual education programs. We are not very good on this subject. The reality is very, very different from the theory, he said. The new measure works in conjunction with other health programs aimed at reducing STI transmission and expanding access to contraception.
Revolutionary therapy clears girls' incurable cancer. A groundbreaking new kind of medicine has successfully treated a teenage girl's untreatable cancer for the first time. For Alyssa's leukemia, every other treatment had failed. In order to create her a new living drug, physicians at Great Ormond Street Hospital performed a feat of biological engineering known as base editing. 6 months later, the cancer is no longer detectable, but Alyssa is still being monitored in case the cancer recurs. Alyssa, a 13-year-old Leicester resident, was diagnosed with T-cell acute lymphoblastic leukemia in May last year. T-cells are meant to act as the body's watchdogs, spotting and eliminating threats, but in Alyssa's case, they had turned dangerous and were out of control.
Man who has just turned 100 refuses to give up his daily 3-hour gym sessions. A great-granddad who recently turned 100 laughed off suggestions that he needs to slow down and is resisting stopping his daily 3-hour workouts. Les Savino claims he has been working out for a long period of time almost every day since the 80s, and he has no plans to stop now. The extremely fit OAP claims that it has a positive impact on both his physical and mental well-being, and that he will continue to defy suggestions to hang up his trainers and towel. Savino, a single man living on his own in Hanover, Pennsylvania, US, claims he lives life like his in his 30s. His visits are jam-packed with cardio, and he always arrives at the gym at 7:30 a.m. That means he's on his way home by 10:30 a.m., and he says it sets him up perfectly for the day ahead. He has plenty of time to work out with weights and completed an 8-mile bike ride in the gym last week.
Ketamine for alcoholics trial goes to next stage. Ketamine-based therapy will be made available to alcoholics as part of a research project. The £2.4 million trial, which is being led by the University of Exeter, will proceed at 7 NHS locations throughout the UK. The trial will examine whether using ketamine along with therapy could help alcoholics maintain sobriety for a longer period of time. There is an urgent need for new therapies, according to Professor Celia Morgan, the academic who conducted the study. After a Phase 2 trial revealed that ketamine and therapy treatment was secure and tolerable for heavy drinkers, the study will proceed. In a previous study, participants who received both ketamine and therapy stayed completely sober, representing 86% abstinence in their 6-month follow-up.
New Zealanders born after 2009 banned from ever smoking in bid for cigarette-free future. In an effort to completely ban smoking, New Zealand has implemented a lifetime ban on young people purchasing cigarettes. Tobacco cannot ever be sold to anyone who was born on or after January 1, 2009, according to the new law that Wellington's Ministry of Health announced 14th, Wednesday, December 2022. It implies that the legal smoking age will continue to rise. Theoretically, someone trying to purchase a pack of cigarettes in 50 years would require identification, proving they were at least 63 years old. But health officials are hopeful that smoking will become less popular much sooner. By the year 2025, they intend to make New Zealand smoke-free. The new law also lowers the amount of nicotine permitted in tobacco that is smoked and reduces the number of retailers allowed to sell tobacco from approximately 6,000 to 600.
Man dies after being bitten by cat as flesh-eating bacteria takes over his blood. For years after being bitten by a cat, a man died from the effects of flesh-eating bacteria that entered his bloodstream and ravaged his body. In 2018, Henrik Kriegbaum Pletner adopted a cat and her tiny kittens from a shelter. However, when they got home, one of the kittens bit him on the index finger as he attempted to move them. In an effort to prevent the same thing from happening to someone else, his family has now come forward to explain what happened. Mr. Pletner thought nothing of the bite, according to his widow, until a few hours later when he noticed his hand had doubled in size. When the Danish man called a doctor, they advised him to wait until the following day, and eventually ended up at Denmark's Kolding Hospital. The 33-year-old spent a month in the hospital and had about 15 operations. But his finger's dysfunction persisted after 4 months, and the doctors decided to amputate. His mother spoke to the neighborhood media and said, he had very fluctuating health. He had a weakened immune system, pneumonia, gout and diabetes. The cat had bitten right into a blood vessel, and when a cat bites and pulls its tooth out, the hole closes and the bacteria spreads. The bacteria entered the bloodstream, according to the doctors, because of the wound. Pletner's family claims he passed away in October, but they have now made their news public in an effort to raise awareness of cat bites.
Tube riddled with toxic air particles linked to cancer that could endanger passengers. Scientists have cautioned that the crowded tube system in London is full of toxic air particles that could seriously endanger the health of passengers. According to new research, metal dust from braking trains enters people's bloodstream after being inhaled into their lungs. They result from the grinding of wheels and rails, and they have been linked to cardiovascular disease, cancer, and dementia. Every day, the tube accommodates up to 5 million passenger trips. Around the capital, more than 543 trains run at peak times. Some of them are 20,000 times smaller than a human hair, making it likely that the scope of the issue has been underestimated. High concentrations of a mineral known as magamite, an iron oxide that only forms over time, were found in the first analysis of its kind. According to the findings, the underground's poor ventilation, especially on station platforms, is to blame for the fragments being suspended for extended periods of time. For your daily global health news, visit www.StayWellWorld.org. Please do well to subscribe, like, share and comment. If you've already subscribed, turn on the notification icon so you don't miss any update. Thank you for watching.